I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of the IDD Health Matters podcast. I have two really cool guests today. I have Kari, Johnston and Jodie Marotz. Did I get that right? Okay, perfect. Welcome to the podcast. So I'll let you decide who wants to go first, but let's just start off by talking about what you currently do in the field of supports and services for people with intellectual and developmental disabilities.
Okay. I am currently the COO of New Horizons. We work with people with developmental intellectual disabilities. We have a variety of settings. We have 5 group homes that people are part of. We provide supports and services to people in a day services program. We help with employment, and we also have people in the community living in their own houses that we go and provide supports to in their own homes.
And this is in Watertown?
Watertown, South
Watertown, South Dakota, yes.
Yep.
And it's great to be here today. I had the pleasure of doing some talks here today, so that was a lot of fun. So, Kari?
Yep. My name is Kari Johnston, and I'm the Executive Director of the Human Service Agency, and part of the umbrella of those services is New Horizons, as Jodie already explained. So
what type of services are provided by New Horizons? Like in the big picture?
In the big picture, we have everything from people who receive supports in the group homes, get help with ADLs, daily living skills, those kinds of things, taking their meds, cooking, learning how to be independent. Our whole point of our services and supports is to work ourselves out of a job, to help people be as independent as they can be.
You know, I like that. You said that, and people listen to the show know that I'm really interested in training healthcare providers, but I really hope I work myself out of a job one day. So that'll mean that all healthcare providers know how to provide good healthcare to people with IDD. Yeah, wouldn't that be great? So, I get it. Yeah. So, under Human Services Agency, what other things are available through the organization?
Sure. We are a community support provider in the New Horizons side, and then we're adjoined with a community mental health center. And in that capacity, we have drug and alcohol services, outpatient counseling, psychiatric services. We have a halfway house. We have services for people that have severe mental illness. And then we also, in the past few years, built crisis stabilization rooms that are often used by, or can be used by, people that are receiving supports from the New Horizons staff as well. And a crisis stabilization room is anyone who is experiencing some kind of mental health crisis. They could be suicidal, they could be manic, they could just be confused off their medication, or a lot of times we have volunteer admissions to our rooms because they just need a place to regroup and make sure that they are safe in the time being, because if they're left in their apartment or their home, maybe they're alone, they don't have a support system, they might continue to deteriorate and then need a higher level of care. So we've been doing that since 2023.
So these other services that you mentioned, are they specifically for people with IDD or not
No, they are available to everyone in our community and our 6-county catchment area.
Okay, very good. Mm-hmm. So how did each of you come into this field? How did you come to work in this
How'd I get so lucky, is what you're saying. How'd I get so lucky? Yeah. Well, I was a teacher originally, and what I realized when I did that was that I was not good at teaching of the English curriculum, but that I very much enjoyed the students. I enjoyed interacting with students and getting to know them. So I started graduate school with the intent on becoming a school counselor, and then just quickly pivoted to understanding that I liked working with people of all ages. I really liked adults and young adults and life development, and just anything that a person experiences in life that they struggle with, I love to help. So I became a counselor. I'm a licensed counselor. I did some drug and alcohol counseling, came back to Watertown, which is, I'm from here originally, and I've been here for 25 years, and I came as a coordinator of children, youth, and family services, and have just kind of worked my way up to the executive director, and have been overseeing New Horizons for 6 years now as well. So.
All right. Jodie, how about you? How did you come into this field?
I was shortly out of college, I went to college for psychology and sociology. Had no idea what I was going to do. I was a waitress. I just applied for the job one day. I got hired. They said, "Can you start tomorrow?" And so I started tomorrow, and I worked both jobs for a couple weeks. Surprisingly, when I started, it was 38 years ago that I started, so there was no training. So I walked in kind of to a mess where the supervisor said, "I'm out of here. I'm there literally 5 minutes. I have no phone numbers to call. I don't know people's names. I don't know what I'm doing." I'm going, what did I get myself into? And I just fell in love with it, and I'm still here. I worked my way up from being a direct support professional. I oversaw residential services for a while. I did quality assurance for a while, and then for the last 7 years, I always get this wrong, 7 years, I think, I have been the COO.
You know, that part about starting as a direct support professional, I hear that so many times. So many people who work in this field started off as a direct support professional. And one of the reasons that I do this is to help people understand that there's a career path in this field, more than, we might think. And we know that direct support professionals and that work is challenging, and it doesn't pay the best. We understand that, but there are a lot of opportunities to learn and grow and really have a fulfilling and rewarding career, I would say, in this field. The other thing I would speak to is when you said that you didn't know what you were doing. I can totally relate to that. I mean, you go to medical school, you think, you're going to know what to do for everybody, right? Well, you really don't, and especially in this field. Unfortunately, we are not all trained to meet the healthcare needs or support needs of people with intellectual and developmental disabilities. And sometimes we fall into this field, which is kind of what I did, and it sounds like we all kind of did that. But sometimes, we have a loved one or a family member that has a disability, and we want to work in that field. And those are the two stories I hear most there. So what are some of the things that are happening right now in the organization? Are there any things that you're working towards, or any new projects, or things to that you're looking forward to implementing?
Can you talk a little bit about the snooze in the room and all the changes we made there?
Okay. Right now, we're doing a revamp kind of the whole agency. We're looking at what people do, how we do it. We are putting in a snoozling room, a room that's it has places for people to de-escalate, to relax. There's chairs with surround music in it. There's lights. There's
So I've heard it called like a sensory room type
Yes,
thing.
absolutely.
But what did you say exactly? I didn't catch it.
Snoozling.
Snoozling.
That's the name of the brand.
Okay, that was about to say, is that a brand name?
Yeah, brand
okay,
name.
that's pretty interesting.
We're just now getting it implemented, and so I haven't actually seen it yet. Jodie is the one who brought the idea to HSA, but it sounds like a mini spa, quite honestly, like where people can
I come?
go chill. Yes,
Yeah,
you can.
yeah.
You can. I know that's what I said to Jodie. I said, when we get it up and running, before we
You're gonna
show
have to
people
test it
supported,
extensively,
we're going
right?
to need to have an
Yeah.
open house for staff so that they can test it out and see how it works. So
Yeah.
that's an exciting thing. Other changes that we have, we're just working on increasing the numbers of the people that we provide supports to.
Which is about how many now, actually?
We have right now we have about 140 people that we provide supports to through all of the services and supports from the New Horizons side.
Okay.
And in our homes, there's about 60 individuals that live in our homes. What's a little bit of a challenge is that we want to have a lower ratio, right? Just so people have more one-on-one support versus 1 to 10 or 1 to 12, because then obviously they're individualized and we can do more individual things with them. So we want to have more people, but then we also want to have individual one-on-one attention. So it's kind of hard when we're short-staffed, and we try to staffing, and as you've heard a million times, they're probably always the tough thing.
So wait, you guys have staffing problems here?
Yeah,
No.
so unique, aren't we?
Yeah, no, gosh, that is such a challenge in this field, unfortunately. And that's one of the things that I actually think is really good about training, because we know that when staff are better trained, they're more likely to hang around, and because they're comfortable with their job, they know what to do. I think I remember. Didn't you say that you were like, I'm out of here because you didn't know what to do? But if you were better trained, that thought might not have crossed your mind. Luckily, you persevered anyway, so that was great. So
that is one of the reasons that we wanted you to come, is because we are trying to improve our training overall, not just our new hire training, but regular
kind of continuing education training.
Yes, whatever it takes, because I agree exactly with what you just said. For a person to enjoy what they do and feel competent and confident at it, they need to feel trained and supported. So I'm excited about that.
It was great here at the break. I was getting a little snack, and one person, I said, "Oh, so what do you do in the field?" He's like, "Oh, I'm a case manager," and he's like, "I just started." I said, "Like just started in this field, or just started, at this place?" He's like, "No, he's like, I'm new to this field and I don't know anything about IDD." And he's like, "Everything I'm hearing is great." And then there was a person standing right next to him, and she says, "I've been in this field for 25 years, and there are things that this is great. Like I'm learning a lot of things." So it's really great to hear, new people and people who've been in this field for a long time. We always have things to learn. I talk about this a lot. It's like, I don't ever want to be an expert. I just want to kind of always be working towards that, because that way you have an open mind and you're always learning and you're always picking up new things. So it's great that you're investing in training for sure. What are some of the other types of training that you think are important for organizations like these to have?
I think it's important for people to learn that people with disabilities are just people. Just listen to them, see what they want, try to get as close as you can to what they want. And one thing I kind of learned the hard way is when people would talk and I wouldn't understand them, I would try to just make up like I kind of understood what they were saying when I didn't. Yeah. They know that, and they take you to task on that. So you really want to just ask them. For the most part, people are okay if you have to ask them 2 or 3 times. So if you're talking to somebody with a disability, don't be afraid to clarify, to get what they're really saying, so that you can listen to them.
So I'm gonna let that be one of your tips at the end, because I'm gonna ask you for 3 things. Okay, so that can be one of them if you run out later. But that's a good one. Is treat people like people first, and if you don't understand what someone's saying, ask. There's no harm in that. There's probably as much or more harm if you're not really sure and you kind of guess and you just make a decision without being really sure of what the situation is. So other training type things that you think are valuable and important?
Well, one of the things I've really learned too through the course of time is that if you've seen one individual with disabilities, you've seen one individual with disabilities, right? Indeed. So everyone has different needs. And so I want us to be able to hear what our staff are saying and what kind of training they feel they need. But we know for sure they need more medical training on how to assess certain situations, when to call the nurse, when to call the ambulance, when to call, all of those things. So we're constantly training on that one too, because I have found that our staff get real insecure when they don't know how to help the person, right? It's a helpless feeling. And so that's that ongoing training we have with a lot of our staff in the houses too. And in the community, it's kind of what Jodie said too, just listening to the people supported and what they need and want and making sure they get that. And it's not our job to dictate that. It's their job to find out what that individual wants and needs and then help them meet that goal.
Yeah. Some of the scariest things or places to be is when we don't know something or we don't understand something. But we can always get more information. We can ask the person, we can ask other people that we work with, people who have been there longer, and getting that information. And again, and going back to providing training and feeling more comfortable with your job is so important. Yeah. Carrie, we were chatting earlier and you mentioned you also are I'm not going to get the term right, trauma, tell me, I'm sorry.
I do debriefings.
Debriefing. Talk about that a little bit.
Sure. I'm a licensed mental health counselor, and we provide debriefings for individuals that have been traumatized by first responding. So we've done a couple of debriefings the past couple of weeks for first responders that have responded to a crime scene and then another car accident that involved a fatality. And so it's a nice way to get out into the communities and help them kind of rebuild after they experience such a awful event. And I've just loved doing that because I love watching everybody come together and watching people who have a passion for helping others is just really invigorating to me.
That's great and important work. And, sometimes when we experience trauma ourselves, it affects us, right? Most of the time, I would say. It affects us in one way, shape, or form. And sometimes even just seeing it or being outwardly involved can really affect us. And, what you said, I'm thinking a lot of it is probably listening to people and hearing their experiences. And that's one of the things that I've learned and am learning more about is trauma in people with intellectual and developmental disabilities. And a big factor is hearing people and just letting people tell their story and having a safe place to talk about, wow, this was really tough, or wow, I didn't like when this happened, or it made me feel this way, or whatever it is. And so that's so important and valuable. So that's
people
great.
Underestimate the power of listening. People think they're good at it. They're often not good at it. They're listening to respond instead of just listening to listen. And some of the people supported that maybe aren't verbal, it's important that the person responding to their trauma, their situation, is calm and makes them feel safe by affirmations with our face, just our body language, being patient, whatever we can do to help soothe them, because that's what they need. Everybody that's been traumatized needs to be soothed, whether they can talk about it or not. That's what they need.
Yeah. I'm Dr. Craig Esquire, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So I am going to ask you now, each of you, okay? So let's talk about three things, 3 tips, 3 words of wisdom, 3 pieces of advice that you would like everyone to know that you think can really improve the world or improve lives or health or supports and services for people with intellectual and developmental disabilities.
We've already said a couple.
You can say them again. I'll give you that.
Okay,
yes.
Okay. I think one of the things is to go along with the listening is to try and just, like Carrie was saying, remain calm, to de-escalate situations. We get a lot of times with people get pulled into this power struggle, and they just need to just remain calm and try to see, like you said, where people are coming from. Because most of the time people are frustrated with what's going on, like you said, past traumas, things that have happened to them before. And so if you just take that time and you get to know the people and you get to know those things about them, it's a lot easier to build that rapport and have a relationship and help them understand what's going on with them also.
Definitely. Building relationships, building rapport is key to just about anything, really.
Absolutely.
Yeah.
Absolutely.
Yeah.
Yep. And then I think just taking time just to enjoy the person, enjoy what you're doing with them. The best times we have are when we're going out, we're just joking, we're going back and forth. You can do all of those things when you're helping somebody brush their teeth or when they're, helping them do their laundry. It doesn't have to be these certain times and these special times that you do it. Just do it throughout, and you can do the teaching and you get to know people. You can do all of that at once, and I think that's really important in helping people to just feel more comfortable and open up with you more.
Yeah.
About what they want.
Great.
Does that count for 3? Is that there?
I'll let you do the counting. You decide.
Well, one thing I have learned through my course of my career is how bad the stigma is with people with disabilities, and that doesn't matter if it's a mental illness or a intellectual or developmental delay. People judge other people, and my advice would be to knock it off and not be so judgmental. but to also just see them as human beings. And people always think that they're not going to be like that, or that is something that wouldn't happen to them. And we are all one bad car accident, one trauma away, one anything away from needing the assistance of other people. And so be kind to other people and stop with the stigma and see each person as an individual that has rights and abilities. It doesn't matter what their disability is. They can love life as much as anyone else. We had the Tim Tebow Foundation come, and we had a prom and a big dance, and all of our people supported, dressed up. They looked great. Some of them arrived in limos. It was just great to see everybody have so much fun. And I think that people underestimate, how like-minded we all are as human beings. I don't care if they're disabled or not. They very much enjoy all these simple things like the rest of us.
Well said. Can't add anything to that.
Does that count for 3? No.
If you wanted to, if you anything else you want to share, anything else that you just want to talk about or you think is valuable or important.
Well, I also think that is along the same lines. I would encourage people to get involved. Like you might not have anyone in your family or your life that has a disability. Then maybe get to know someone that does, because it doesn't. I mean, you could volunteer with a community support provider or a community mental health center. You can get involved with the church. You can mentor anyone. There are a lot of people that have disabilities that also don't have families, and there's many reasons why that is. But then they could sure use just the love and compassion of other people, and volunteering is one way to do that. We have a few families in our small community that will take people supported home for Christmas with them because they don't have families to do that. And it just makes a world of difference that you get to know someone that has disabilities. Maybe otherwise didn't have the opportunity to do that. So I would just say, get out there and do that. Like, get to know people.
I love it. I love it. Anything else to add? Yeah,
I guess I would just like to mention quickly how much things have changed through the years since I started, 30 odd years ago, how people were treated and the way we thought about things, the way we talked to people, did those kinds of things. We've come a long, long way in that, I think. And I think some of that is early education, the things you see in school. When my kids were little and there was a little boy with disability in school, and they were at a program, and he would step out of the line and he'd go do something else. One little girl would just go get him and take his hand and lead him back. And I think those things are making a big difference. I think we have a long way to go. Yeah. But I think we've come a long way also, and I just want to acknowledge that we are getting there. We are not there.
Yeah, thank you for acknowledging that, because sometimes we do focus on what's not there yet and forget about the places that we have come from. And things have gotten a lot better in a lot of ways. And you're right, there still is more work to do. Thank you for doing that and helping with that, of course. Thank you for taking the time to talk with me today. Thanks for having me out to South Dakota. It was my first trip, and it was great.
Yeah.
And, again, just thanks for the incredible work that both of you do in the field.
Well, thank you for what you're doing. We'd like to spread you all over South Dakota and have you come back many times. So thank you very much.
Thank you. I'll do it.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.